Assalamu alaikum. I am Dr. Salma Akhtar, Professor and Head Department of Physiology at the Women's Medical College. Today, in this online session, I will take your class on conductive system of heart. So, the junctional tissue or conductive system comprises of this part, that is SA node, internodal pathway, AV node, EV bundle, and the left and right bundle branches of Purkinje fibers. So before going to this description of the junctional tissues of the heart, I will tell you something about the action potential in heart muscle. Action potential in heart muscle, that means the ventricular muscles. The resting membrane potential is minus 85 to 95 millivolt, that is average 90 millivolt, minus 90 millivolt, and the depolarization is due to depolarization wave. This is plateau and this is repolarization. Depolarization is due to influx of sodium ion. Plateau is due to slow opening of calcium and sodium ion, and then influx of this calcium and sodium ion, and repolarization again due to potassium efflux. And then the action potential of SA node, which is different from the ventricular muscle action potential. In this figure, both the action potential of ventricular muscle and SA node is shown. So, the SA node, it is the SA node action potential. Its resting membrane potential is minus 55 to minus 60 millivolts, and the depolarization wave is due to slow sodium calcium channel. Depolarization is influx of sodium calcium ion, and repolarization is again due to potassium efflux. And SA node, we know that SA node can initiate its own impulse because there is an inherent leakiness of the SA nodal fibers, and this inherent leakiness causes pacemaker potential. That is when its resting membrane potential is minus 55 to minus 60 millivolt, and as it is leaky to sodium and calcium ion, sodium calcium enter into the cell, and the resting membrane potential becomes minus 40 millivolt. This is the firing point, and this pre-potential is present in SA node and AV node, but they are absent in atrial and ventricular muscle. Now, about the junctional tissue. These are the location of junctional tissue. SA node is present at the posterior wall of the right atria, just below the opening of superior vena cava. And AV node is also present in the posterior wall of right atria, and this AV node and SA node is connected by internodal pathways. Then this is AV bundle, which penetrate the atrioventricular septum, and then the AV bundle become branched into right and left, and these are the Purkinje fibers. So SA node is known as pacemaker of the heart because it generates the impulse at first, and the rate of impulse generation is the highest, and so it maintains the normal heart rate. But AV node, that is the atrioventricular node, which is located in the posterior wall, they can also produce impulse, but the rate of impulse generation is less than SA node, which is about 40 to 60 impulse per minute. In AV node, AV nodal delay is important. AV nodal delay, we see that for the impulse conduction from SA node to AV node, it requires 0.03 second. But there is a delay in AV node, that is 0.09 second is delay after entering the AV node. And then another delay occurs in the AV bundle, and the time is 0.04 second, which is this delay occurs in the penetrating portion of AV bundle. So totally the delay in AV node and AV bundle is 0.13 second. So 0.13 second plus 0.03 second, that is from SA node to bundle branch, it requires about 0.16 second. This is the figure showing the conduction time. SA node to AV node, it requires 0.03 second. Again in the AV node and AV bundle, another 0.13 second is required. It is delayed in AV node and AV bundle. So what are the causes of this nodal delay or AV nodal delay? Because the AV nodal fibers are less, their decreased size, and also the gap junctions are less in AV node and AV bundle. But it has a great importance because it allows the atrial systole to complete before the ventricle is excited. So this is the figure, the time, that is SA node. In SA node, it shows that in SA node at first impulse is generated, and we know that SA nodal fibers are continuous with the atrial muscle. So when there is a impulse generation, it is conducted throughout the atria. So first atria is excited, so atrial systole occurs. But these excitation also go to the ventricles, but it requires some time. So it is shown that the time is required about 0.17 second, or totally it is 0.19 second. So ventricular systole occurs after the end of atrial systole. Atrial systole occurs at first. Now this table show the rate of velocity, that is rate of conduction and rate of impulse generation. Yes, a note. The rate of conduction is less, that is 0.05 meter per second, but impulse generation is highest. It is 60 to 100 impulse per minute. In AV node, in this case, impulse generation is 40 to 60 impulse per minute, but the conduction rate is low. But Purkinje fiber, in this area, impulse generation is less, that is 15 to 40 impulse per minute, but they have highest conduction rate, that is 1.5 to 4 meter per second. And the atrial and ventricular muscle, they have no impulse generation property, but they can conduct the impulse. Now, Stokes-Adams syndrome. It is a condition. It occurs when the conduction of impulse is failed from atria to ventricle. Then ventricular muscle, that is the Purkinje fiber, can generate the impulse at a rate of 15 to 40 impulse per minute. But it requires some time, that is about 5 to 30 seconds. And it occurs later because it is not used to, and it is suppressed, and it is overdriven by the SA nodal impulse. So it takes time, but in the meantime, that is within the 4 to 5 seconds, the person can faint because of less blood supply to the brain, and this delayed pickup of heartbeat is known as Stokes-Adams syndrome. Stokes-Adams syndrome. So another point is there, that is a ventricular escape. It shows that if the impulse conduction fails from the atria to ventricle, ventricle can initiate its own impulse, and it is called ventricular escape. Now, the regulation of heart activity by autonomic nervous system. We know that autonomic nervous system has two parts, sympathetic nerves and parasympathetic nervous system. So what are the effects of sympathetic nerve on heart? This figure shows the sympathetic supply and also the parasympathetic supply. Sympathetic supply about all parts of the heart, especially the ventricles, ventricular muscle, and it has positive effect. Sympathetic nerve has stimulatory or positive effect on the heart. That is, it increases the frequency of heart rate, and it is called positive chronotropic effect. Chronotropic means related to heart rate. Positive inotropic effect. Inotropic means force of contraction. So, sympathetic causes increased force of contraction. Then the third one is bathmotropic effect, that is excitability. Increase of excitability is called positive bathmotropic effect. And last is dromotropic effect. Dromotropic means conductivity. So positive dromotropic effect, that sympathetic stimulation cause increase the conductivity. So all the effects are positive, that is stimulatory. So for sympathetic nervous system, it increases the heart rate, it increases the force of contraction, it increases the excitability, and also it increases the conductivity. And what about the parasympathetic nerves? It is shown that parasympathetic is supplied to the SA node and AV node, and the effect is just opposite to the sympathetic, that is parasympathetic effect is negative to the heart, that is it decreases the heart rate, that is negative chronotropic effect. It decreases the conductivity, that is negative dromotropic effect. It decreases the force of contraction, that is negative inotropic effect, and also bathmotropic effect, that is excitability is also decreased. So there is decrease of duration of systole and the refractory period also decreased. So all the effects are inhibitory due to parasympathetic stimulation. So parasympathetic causes inhibitory to the heart muscle. Now I will give you some assignment, that is questions. These are the questions. You copy these questions and these are the assignment. So the question I read at first. First question is mention the properties of cardiac muscle and describe any two of them. Second question is what to mean by Frank-Starling law and refractory period. Mention their importance. Third question, draw and label the junctional tissues of the heart. Why SA node is called pacemaker. Fourth question is another drawing. Draw and label the action potential of SA node and ventricular muscle. That is action potential of ventricular muscle. And fifth question is write down the effects of autonomic nervous system on heart, both sympathetic and parasympathetic. And sixth question, that is short notes. Short notes on functional syncytium, AV nodal delay, and Stokes-Adams syndrome. So you prepare yourself because first item is completed and these are the question of first item, and it is your assignment. Make a khata or notebook, write these answers with question and answer. and if you have any problem, you can discuss with your best teachers. They can help you. So thank you.